Good morning and good afternoon, everybody, and very warm welcome to our event, showcasing WHO rehabilitation assistive technology and disability inclusion activities to support Ukraine. My name is Satish, and I am the WHO Regional Office for Europe in charge and lead on disability rehabilitation, palliative care, and long-term care. I'll be chairing today's meeting, which will last for 1 hour. Let me start with some practical information. The meeting is being recorded, and a copy of the recording will be made available on our website within a week. Owing to the potential power disruption in Ukraine, as well as speaking to you live, presenters from Ukraine have also pre-recorded their presentation. In the case that we lose our connection with them, we will switch to their video recording. The presentation will be delivered in English or Ukrainian with simultaneous interpretation available in Arabic, German, French, Russian, Ukrainian, as well as in Spanish. To select the language feed you prefer, please click on the globe icon at the bottom of the screen and select the language channel of your choice. Since the large-scale invasion of Ukraine by the Russian Federation, which began a year ago in February 2022, the need for rehabilitation and assistive technology in Ukraine and surrounding countries has arguably never been greater. While we also have the duty to protect the most affected, including internally displaced people and refugees and persons with disabilities. Today's hour-long webinar will detail our work in Ukraine, which has been made possible with collaboration with many donors and fantastic partners. We have a packed agenda for our 1 hour together that covers all areas of our work, with many of our speakers joining directly from Ukraine. We are honored to have speakers from Office of the President of Ukraine and Ministry of Health, as well as our WHO representative in Ukraine. You will then hear from our regional and Ukraine country office team, who will tell you about our work in the areas of policy and legislative level actions, our rapid access to assistive technology projects, support to hospitals across the country on issues related with specialized rehabilitation, with the work happening related with spinal cord injury and traumatic brain injury rehabilitation, and to support the work on disability inclusion in Ukraine and refugees in surrounding countries. To get started, I'm honored to introduce to you our first speaker, Yulia Sokolowska, the Deputy Head of Office of the President of Ukraine. Can we have the audio visual, please?
I sincerely greet the participants and guests of this important event. I'm grateful to the World Health Organization and the international community for supporting Ukraine in this difficult time. The issue of rehabilitation is always urgent and important. However, in the conditions of Russia's military aggression against Ukraine, the rehabilitation of its victims becomes extremely important, with a particular task to amplify their recovery and return them to active social life. Even before the start of the full-scale war, Ukraine already launched creation of a modern, effective rehabilitation system. It is built on the evidence-based medicine, using the best world standards and methods aimed at assisting everyone who needs it. Notwithstanding the invasion of the Russian Federation into Ukraine, the development of the new rehabilitation system was not stopped. We accelerated our efforts and took into account the new challenges that we have faced now. It was during the war that the International Classification on Functioning, Disability and Health was introduced into national legislation, while the development of electronic rehabilitation model in a health system is being completed. This will allow comprehensive recording of both medical and non-medical services for patients. Currently, the organizational process has already been improved. All injured citizens, both military personnel and civilians, start to receive rehabilitation assistance in the hospital immediately after surgical or other intervention, with the involvement of the multidisciplinary teams. This will contribute to achieving rehabilitation goals in the shortest possible time, reducing complications and the level of disability of patients. We are working on the creation of assistive technology offices in hospitals, where prostheses will be selected, adjusted, manufactured, and patients will be taught how to use them. It is extremely important to provide people with the innovative assistive technologies, which will help to restore their functionality as much as possible and allow them to regain economic independence. The prosthetics industry and education are developing in Ukraine. Due to the war, the complexity of cases and amputations is enormous. This stimulates acquisition of unique skills by both doctors and other specialists, including prosthetists. WHO and other international partners supply assistive technologies and rehabilitation equipment to Ukraine. We also open humanitarian account to collect contributions for these purposes as well. Ukraine will make an invaluable contribution to the global development of rehabilitation and will open up the possibility of creating a huge concentration on knowledge and practical skills. Ukrainians also suffer from psychological stress and trauma on a daily basis. This is why psychological help should be as accessible as medical help is. With the initiative of the First Lady of Ukraine, Olena Zelensky, and the support of the WHO, we are developing and implementing the All-Ukrainian Mental Health Program. My vision for the positive development of rehabilitation is undoubtedly the development of a complex, evidence-based, human-centered rehabilitation model, with the implementation of the best world practices and technologies, adjusted in accordance with our experience gained during the war. The restoration of Ukraine is primarily the restoration and development of human capital. I thank you.
Thank you. And thank you, Yulia, for taking the time to show your support for our work and convey that Ukrainian government understands the vital importance of rehabilitation and assistive technology within the Ukrainian health system. Next, I'm delighted to welcome Dr. Viktor Lashko, the Minister of Health of Ukraine, whose presentation to you will be translated from Ukrainian. Can we have the audiovisual, please?
Доброго дня, шановні колеги. Щирі вітання від Міністерства охорони здоров'я України. Стратегічна співпраця Міністерства з Всесвітньою організацією охорони здоров'я в частині реабілітації розпочалась після початку війни з Російською Федерацією. В 2015 році з візитом до України технічної консультації за участі експертів Всесвітньої організації охорони здоров'я та Міжнародного товариства фізичної і реабілітаційної медицини. Метою візиту було створення національного плану щодо обмежень життєдіяльності, здоров'я та реабілітації в Україні. Експерти запропонували кроки, що мають бути зроблені в частині внесення змін в наявної на той час медичної інфраструктури та формування відсутньої тоді в Україні системи фахівців з реабілітації. Відтоді ми почали розбудовувати сучасну систему реабілітації у сфері охорони здоров'я. Першими кроками було запровадження нових для України професій фахівців з реабілітації, що працюють у сфері охорони здоров'я, лікарів фізичної та реабілітаційної медицини, фізичних терапевтів, ерготерапевтів, терапевтів мови та мовлення, а також нової філософії надання реабілітаційної допомоги, що ґрунтується на моделі міжнародної класифікації функціонування, обмеження життєдіяльності та здоров'я. Ця системна і кропітка робота сформувала підстави для змін на законодавчому рівні. І вже у 2020 році Верховною Радою України було прийнято Закон України про реабілітацію у сфері охорони здоров'я. Цей закон сформував міцну платформу для подальших системних змін на рівні підзаконних нормативних актів. Це, зокрема, стосується сучасного формату розуміння обмежень життєдіяльності як результату взаємодії особи і її середовища. Ми дякуємо Всесвітній організації охорони здоров'я за проведення у 2020-2021 роках ситуаційних аналізів щодо реабілітації, а також допоміжних технологій в Україні, які надали можливість до початку повномасштабного вторгнення Російської Федерації в Україну розпочати нам створювати стратегію розвитку системи реабілітаційної допомоги, системи надання допоміжних засобів реабілітації, а також інклюзії при обмеженнях життєдіяльності. Це також дозволило нам сформувати і перші ключові нормативні документи щодо організації надання реабілітаційної допомоги у сфері охорони здоров'я впродовж усіх реабілітаційних періодів, яка має починатись одразу після отримання особою травми або захворювання. Також створили принципи організації роботи стаціонарних відділень після гострої та довготривалої реабілітації, нормативні засади надання реабілітаційної допомоги мультидисциплінарними реабілітаційними командами. Вперше в історії України започаткували нормативи навантаження фахівців з реабілітації. Водночас медична реформа в Україні і запуск програми медичних гарантій на рівні спеціалізованої медичної допомоги з квітня 2020 року, зокрема створення пакетів медичних гарантій з реабілітаційної допомоги, також були потужним стимулом для закладів охорони здоров'я починати розвиток реабілітаційних відділень та підрозділів. Дякую за увагу і бажаю всім міцного здоров'я.
Thank you very much, Dr. Victor Lashko. Equally, WHO values our close relationship, which has already achieved so much, with so much more to come. Thank you very much for your close collaboration. Next, I welcome Dr. Jarno Habic, my colleague, WHO representative and head of WHO country office in Ukraine, who has been working tirelessly to support the Ukrainian population health needs. Over to you, Jarno, please.
Good afternoon, and thank you, Satish, for opening. And first of all, I would like to thank all of the colleagues and those interested who have joined today's webinar. It's very important that we talk today about rehabilitation, where we mark more than 1 year of Russian Federation invasion to Ukraine and the impact of the war that has brought to many civilians across the whole country. I'd like to thank, first of all, also the healthcare workers, the nurses, the doctors, the physiotherapists, ergotherapists, many others who are working 24/7 to support people in Ukraine, many civilians across all the oblasts who are victims of the war. Our focus as WHO since 24th of February 2022 has been more focused to rehabilitation. It has been more important and more intensive. This was something that Minister Viktor Lashko and also Yulia Sokolovska from the President's office mentioned. We worked together on the rehabilitation and assistive technologies before February 2022. But now the work has become much more important and much more intensive. And this is due to various injuries. Today's webinar, we started with a story of the child from Kherson, who we were able to meet together with also our regional director's recent visit to Kiev, and to see the Ohmedit Hospital, how they are building up the rehabilitation services, what are now needed across the whole country. So children, they need the rehab services much more. In Poltava a few weeks ago, I saw a man who had a stroke. They need also rehabilitation services. He had a great support from the healthcare workers to learn how to use his hands again after the stroke. And he was very appreciative to see the change in the health system that can support him. But also, I have seen a number who need rehab services in Dnipro, where we have also the services set up. So what I want to tell through these examples, we have a number of civilians who need now rehabilitative services, and this number is much bigger due to various reasons that we're witnessing. But the health system is resilient. Even after more than 800 attacks on health that WHO has been witnessing, as well we have monitored and reported. And in this environment, we need to ensure that the rehabilitation services, which were started to be built up before 24th of February 2022 will be even further developed across the whole country, that people have rehab services close to their homes where they need them most. As a WHO, to date, we have supported more than 4,000 people in more than 25 facilities with the rehabilitative services. This is related to the services, but this is also related to the equipment and supplies which are needed to provide those services by the heroic healthcare workers as they are doing their work. So where we are going further in the coming years, our focus is really to work on health systems and at the same time, emergency response as the war goes on. As we say, we need to work on the response, recovery, and the reforms at the same time. What it means for the rehabilitation is we continue to work further on the policy developments, and my colleagues will share more during the webinar what WHO did before escalation of the war and what we are planning to do further. But we go few steps further from policy and strategic work, what is usually WHO's remit. We also do a lot of the capacity building to ensure that Ukraine healthcare workers can learn from the best. And I really want to thank all of my team members who have come from various countries, from Canada to Australia, from India to Sweden or Norway to UK. Those healthcare workers who have come to Ukraine to support Ukraine this hard time. So I'd like to thank Ukraine healthcare workers, but also all of the healthcare workers who are coming to Ukraine to share their knowledge and capacity to make the health services more sustainable in Ukraine. And the third, we need to see that the supplies are also there, that we have assistive technologies available, as well other supplies for the facilities. For in the coming years, you will see WHO working on policies and strategies, capacity building, as well on the supplies, on the rehabilitation, for the rehabilitation and assistive technologies. So, and all of this we need to do in coordination with partners, because what we share today in the webinar is what WHO does. But we are recognizing there are tens of partners, interested parties who have come to Ukraine, public or private sector, to support Ukraine rehab services to grow. What is ahead of us is important in its coordination to ensure that all of these efforts that are done by different partners, they go in one direction, and that we can learn how Ukraine has started to develop its rehab services since 2015 and 16, and continue the same path to ensure that we are building in the coming years, and we are supporting the building of in the coming years to Ukraine rehab services. And today we are talking about physical rehabilitation, but it needs to be connected to the whole health system, from primary health care to specialized care, from rehab to mental health, from managing chronic diseases to injuries. Thank you. Stay well, stay safe. Ďakujem.
Thank you very much, Jarno. And we fully align that a long-term approach is needed to build health system capacity. And thank you for all your support in the area of disability, rehabilitation, assisted technology, not only in the last 1 year, but since the work began in Ukraine since early 2019. Now, let me summarize the need and complexity of delivering rehabilitation services in Ukraine. Thousands of people in Ukraine have sustained complex war-related injuries that need rehabilitation services and assisted technology. Injuries resulting from war can cause devastating and long-lasting physical and psychological impact, requiring early and specialized rehabilitation interventions from multidisciplinary rehabilitation team and long-term follow-up to reduce complications and to optimize independence and quality of life. The type and severity of injuries sustained vary amongst population, and people often present with pre-existing health conditions alongside multiple complex injuries that require rehabilitation. Examples of those complex injuries include fractures amputations, spinal cord injuries, traumatic brain injuries, burns, among others. At the same time, the need for rehabilitation that is not directly related to the war, such as people with conditions related with non-communicable diseases like cardiovascular disease, stroke, diabetes, cancer, aging population, as well as persons with disabilities continues. Therefore, the rehabilitation need of Ukrainian population are increasing in the face of complex barriers to accessing healthcare during the war. The barriers include targeted attacks on healthcare facilities, fewer availability of healthcare workers due to displacement, reduced public transportation, interrupted supply chains, and power shortages. Consequently, the war increases both the demand for rehabilitation and difficulties in accessing services, compounding the already existing unmet rehabilitation needs. Providing coordinated ongoing care and rehabilitation for those affected by war is one of the greatest challenges faced in many health emergencies. There can be significant and life-changing consequences for those whose rehabilitation needs are unmet or delayed, leaving a legacy of deprivation and exclusion from society for years to come. Early rehabilitation has been shown to reduce the impact of the health condition and improve the quality of life. Evidence suggests that those who receive rehabilitation services they need have reduced length of hospital stay, fewer complications, and better clinical outcomes. Long-term rehabilitation is a wise societal investment, cutting the cost of ongoing care and supporting individuals to participate in education, employment, or in society. Following the large-scale Russian invasion, the WHO included rehabilitation in its response under the health emergency operation through launch of the Trauma Rehabilitation Working Group. Stakeholders in the working group include national and international partners active in the area of rehabilitation, as well as different government ministries. The group is co-chaired by WHO and Ministry of Health, as well as other relevant ministries. There's an urgent need to strengthen coordination, reinforce existing services, and rapidly develop technical resources and complementary service delivery mechanisms for rehabilitation and assisted technology. Humanitarian actions implemented now also need to take into account long-term sustainability. Therefore, WHO devised a rehabilitation response strategy in collaboration with the Ukrainian government and neighboring countries who are supporting the refugee response. The strategy is designed to support health system strengthening across humanitarian and development response in Ukraine. The strategy enabled a rapid emergency response while supporting long-term and sustainable service development. The strategy places WHO in the leading role of overall coordination of rehabilitation to ensure access to quality services for target population. Specifically, Ukrainians who have sustained traumatic injury, as well as all Ukrainians, both inside Ukraine and in neighboring countries who have a long-term health condition that need rehabilitation services, or people with disabilities. The main pillar of this strategy are, number one, technical support to key government ministries and agencies on disability inclusion, rehabilitation, and assisted technology, policies, and system strengthening. Number two, strengthen rehabilitation and assisted technology in acute, post-acute, and specialized rehabilitation, as well as in the community. Number three, targeted provision of assistive products and rehabilitation for internally displaced people and refugees. And number four, to promote disability inclusion in humanitarian response. A technical assessment was undertaken to assess the situation and requirements of rehabilitation and assisted technology, including for people with disabilities. The report is now available on our website in English and Ukrainian and summarizes the main findings and recommendations from the assessment to contribute to and support a collaborative, effective, and inclusive response. Our advocacy efforts has also been detailed in Lancet editorials. WHO has been able to rapidly respond, having already worked in the country for a number of years, supporting the development of rehabilitation, assisted technology, and disability inclusion sectors. My colleague, Cathal Morgan, Technical Officer, Disability Rehabilitation and Assisted Technology in the WHO Regional Office for Europe, will now speak about this foundational work which was done before the war. Over to you, Cathal, please.
Thank you, Satish. Firstly, let us define what we mean by rehabilitation. So when we talk about rehabilitation, we mean that it's a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment, and considers rehabilitation as a key element of universal health coverage. Acknowledging its importance, the WHO recognizes rehabilitation as an essential component of the emergency response, and the vital role and benefits of rehabilitation are well recognized in global rehabilitation disaster and emergency response guidelines from the highest authorities in health. We know that before the war, the need to scale access to rehabilitation and unmet need was already very, very significant. Our flagship regional report, The Need for Rehabilitation Services in the WHO European region, quantifies the need for rehabilitation services not only for the region as a whole, but for each of the 53 countries in the WHO European region. The data is derived from the 2019 Global Burden of Diseases, Injuries and Risk Factor studies, which assess the prevalence and incidence, as well as years lived with disability resulting from over 300 diseases and injuries. A total of 25 disease causes, impairments, and sequelae that are amenable to rehabilitation at some point in their course were also identified. For each member state of the WHO European region, the need for rehabilitation was described by presenting the prevalence and years lived with disability of the conditions amenable to rehabilitation. A total of 25 disease causes, impairments, and sequelae that are amenable to rehabilitation is important to emphasize. And in the WHO European region in 2019, 394 million people had a health condition amenable to rehabilitation during its course, and this represents 2 in 5 people. Next slide, please. For Ukraine, the need was even greater, with 1 in 2 people who could benefit from rehabilitation. Musculoskeletal disorders, sensory impairments, and neurological disorders were the most prevalent groups of health conditions which were driving the need for rehabilitation services. We know that this data is an underestimation, and that's important to emphasize, as it only accounts for the need derived from non-communicable diseases, such as cardiovascular disease or diabetes, amongst others. Furthermore, since 2019, we have had the COVID-19 pandemic, which has significantly increased the need for rehabilitation services, particularly for those who have had severe infections requiring hospitalization and for those living with long COVID. And now we also have the need resulting directly from the impact of the war. Hence, the need for urgency and to develop rehabilitation with access to assistive technology is even greater and even more urgent now. Next slide, please. Before February 22, the WHO Regional Office for Europe and the WHO Country Office in Ukraine was already very active, supporting and collaborating with the Ministry of Health, the Ministry of Social Policy, and other state agencies in integrating rehabilitation into the national health system. In August 2020, the WHO Situation of Rehabilitation in the Ukrainian Health System assessment was conducted, and in 2021, the STARS report was published in a collaboration between the Ukrainian Ministry of Health, the WHO Country Office, and the WHO Regional Office for Europe. This foundational report outlines key achievements. It outlines needs and opportunities for rehabilitation in Ukraine, with the Ministry of Health recognizing rehabilitation as a key component of universal health coverage. Furthermore, The WHO initiated a national analysis of assistive technologies in 2021 to assess the current status of assistive technology services and areas for development. And from a WHO perspective, this intensive work and relationship building did help in supporting the emergency response in early 2022. Thank you.
Thank you very much, Kahal, and for that overview of the foundations that supported the rehabilitation humanitarian work. Now I hand over to my colleague, Dr. Volodymyr Golik, National Professional Officer, who's based in WHO Country Office in Ukraine, and whose work is invaluable to the program. Volodymyr is going to present WHO technical support to implement vital system-level changes made through policy adoption and new laws that is so important to the development of health and rehabilitation sector in Ukraine. He's also going to present the early humanitarian response work. Over to you, Volodymyr, please.
Thank you, Satish, and warm greetings from Dnipro. Since the beginning of the war, the development of the rehabilitation sector within the healthcare system in Ukraine has vastly accelerated with significant positive momentum from the state level. Change must come from the top and be implemented system-wide to have a significant and long-term impact. We at WHO are very happy with our extremely close and fruitful collaboration with all state bodies in Ukraine involved in the areas of rehabilitation and assistive technology. These state bodies include the Ministry of Health of Ukraine, the Ministry of Social Policy of Ukraine, the Ministry of Veteran Affairs, the Office of the President of Ukraine, Verkhovna Rada, the Parliament of Ukraine, and the National Health Service of Ukraine. WHO is directly collaborating with all state bodies in the area of rehabilitation and assistive technologies, including supporting with the development of new regulations and legislation. The first big development came when in 2020, Ukraine adopted the new landmark law of Ukraine about rehabilitation in healthcare, which introduced modern rehabilitation to the health system with the emphasis that a rehabilitation should be initiated from the onset of acute health condition. Following the law, the first Cabinet of Ministers order was adopted in November 2021, introducing regulation for the organization of rehabilitation services in healthcare, an example model for rehabilitation department, and an example model of multidisciplinary rehabilitation team practice, which has previously not been strong in Ukraine. These hugely significant developments have continued since, and in the midst of the war, Parliament adopted an amendment to the law of Ukraine Fundamentals of Healthcare, which made rehabilitation services are a mandatory inpatient service in hospitals. What goes on despite the war? Implementation of the law of Ukraine about rehabilitation in healthcare continued last autumn with the adoption of the second order of the Cabinet of Ministers of Ukraine. The order introduced regulation for the provision of assistive products, including providing prostheses for inpatient rehabilitation services inside hospitals and after discharge. Assistive technology units were introduced as part of inpatient rehabilitation departments, and digital rehabilitation record system, as it was mentioned by Yulia Sokolovskaya, to be implemented countrywide. To upscale rehabilitation service and improve the quality of service delivery, the rehabilitation professions need to be formally recognized. First, physician of physical and rehabilitation medicine, physical therapist, and ergotherapist were recognized in 2016, and then speech and language therapists in 2021. Rehabilitation nurses were recognized on December 29, 2022. In mid-November 2022, the Ministry of Health of Ukraine adopted the order on the regulation of the organization of rehabilitation services across rehabilitation pathways. The order describes the general principles of rehabilitation care and criteria for the completion of each of the rehabilitation phases, as well as referral pathways across the continuum of healthcare. Pathways were described for patients with health conditions and injuries related to the war, such as for spinal cord injury, traumatic brain injury, burns, limb amputations, and complex limb trauma. The pathways apply nationally for both civilian and military cases. The same order adopted the obligatory use of several internationally accepted assessment tools to the support onward referral decision. Based on WHO recommendation, the National Health Service of Ukraine implemented separate inpatient and outpatient rehabilitation payment packages. That's all the recent regulation and legislation development. Now, let me tell more about the WHO early humanitarian response. Early in humanitarian response, WHO delivered 86 trauma kits to 11 trauma hospitals in the country, enough to serve 2,500 people. The 86 kits contained multiples of 6 essential assistive products to support surgical interventions in the hospital. Furthermore, WHO supported 6 hospitals in the East, North, and Central Ukraine with the personal training and donations of essential rehabilitation equipment and assistive products to benefit at least 300 hospitalized persons per month. Thank you, and over to you, Satish.
Thank you. Thank you, Voldemir, for that comprehensive run through all of the very important regulatory changes recently implemented, despite the huge challenges posed by the war. It's incredible what has been achieved, and we cannot applaud all those involved enough. Continuing from our systems and acute phase responses, I would like to introduce Ashish Ranjan, WHO Project Coordinator, and involved in developing specialized care rehabilitation, especially with focus on spinal cord injury and traumatic brain injury. Over to you, Ashish, please.
Thank you for your introduction, Satish. Warm greetings from Rivne, Ukraine. We are seeing many cases of very complex injuries, such as traumatic brain injuries, spinal cord injuries in Ukraine, resulting from the impact of the conflict. Medical care, rehabilitation, psychosocial support, and ongoing care are essential for preventing of complications and good management of these conditions. And there is often a lifelong need for support. Rehabilitation and assistive technologies are often required to facilitate movement, communication, self-care, and participation in activities of daily living. In the absence of rehabilitation and assistive technologies, these injuries can render a person dependent on caregivers, which can have a significant negative socio-economic impact on the individual, family, and larger society as a whole. Until last year, no specialized spinal cord or traumatic brain injury rehab center or post-discharge services existed in Ukraine. Next slide, please. Recognizing the gap in services and urgent need under the Ukraine Rehabilitation Response Strategy, the Ministry of Health and World Health Organization jointly identified an existing rehabilitation center to be strengthened and expanded to become a national spinal cord and traumatic brain injury rehabilitation center. The center was supported by WHO and developed so that the center can offer high quality care and rehabilitation to those with such complex injuries, to improve their independency as well as to improve their quality of life. By admitting persons with these complex injuries, the center reduces the burden on the healthcare system and provides the post-discharge follow-up so greatly needed. Next slide, please. To achieve this, WHO, in coordination with Ministry of Health, support the rehabilitation center. WHO deployed a multi-professional international team of rehabilitation professionals to the center for 6 months. The team includes physical rehabilitation medicine doctors, physical therapist, occupational therapist, nursing specialist, and clinical neuropsychologist. The team provides clinical case management and workforce training, including building the capacity of local rehabilitation professionals. As the hospital capacity has increased, additional local staff has also been recruited. The International Spinal Cord Injury Society, ISCOS, has also been a critical partner in developing the quality of services. WHO has also provided the required medical and rehabilitation equipment, training materials, and supply to the center. Developing services, WHO has also supported the opening of a center-based workshop for assistive technology, repairs, modifications, and work follow-up services. The development of a specialist center is something for all involved to be very proud of, and it has already positively impacted the lives of so many severely injured people. Thank you. Over to you.
Thank you very much, Ashish. The development of the National Rehabilitation Center certainly is something to be very proud of, and will support those in need of specialized rehabilitation services for years to come. Also speaking to you from Ukraine, I now introduce Tatiana Bereshchuk, physical therapist from National Rehabilitation Academy and Ukrainian Association of Physical Therapists. Tatiana will present the 8010 Assistive Technology 10 project, which is one of the largest assistive technology provision project of its first ever kind delivered in a humanitarian setting by WHO. You have the floor, Tatiana, please.
Thank you, Satish. Meeting from Ukraine. Assistive technologies enables people to live independent, productive, and healthy lives. Assistive products are devices for individuals with impaired hearing, vision, mobility, self-care, and include wheelchairs, walkers, prostheses, spectacles, hearing aids, etc. Without assistive products, these individuals are at risk of being socially excluded, of falling into poverty, of depending on their family and society to a great extent. The positive impact of assistive technology goes beyond individual benefits by enabling access to education, a more productive workforce, and decreasing the need for hospitalization, leading to reduced health and welfare costs for a country. Access to assistive products is not only a human right protected under the Convention on the Rights of Persons with Disabilities, but also a worthwhile long-term investment. The war was resulted in a large number of people with injuries who will need assistive products for their mobility and self-care needs as a first priority. People who use assistive technology are fleeing from conflict, are likely to have left their assisting products behind, and will need replacement devices for their health and to enable evacuation. Assistive technology products need to be provided within a service delivery framework and adapted to that context. This is to ensure people receive the most appropriate product, can use it safely and effectively, and where possible, referrals are made for further care and future follow-up. To meet the huge need for assistive products, WHO and Ministry of Health collaborated to initiate the 8010 project. The objectives of 8010 in Ukraine were to, first, establish rapid service delivery mechanism with trained personnel to provide 8010 kits. Second, meet the immediate assistive technology needs for internally displaced people and people affected by conflict in Ukraine. 8010 includes the WHO online training in assistive products, TAP, which is a free interactive learning resource that teaches how to provide simple assistive products through 4 steps: select, fit, use, follow up. 8010 kits include 10 mobility and self-care products to support the population with new or exciting IT needs, including internally displaced people and refugees. Each kit is based on 1,200 assistive products, meeting the estimated need to 10,000 displaced or war-affected people and can be adapted to available baseline data. The 8010 kits were developed specifically for the Ukraine response, drawing on the information that Castle presented earlier, anecdotal evidence from Ukraine, and consultation with stakeholders. 5 8010 kits containing 3,900 assistive products were procured and distributed to 10 locations and has benefited nearly 1,500 people up to the end of February 2023. Nearly 100 personnel from 10 health facilities across 5 oblasts have been trained in TAP. 5 more kits have been procured and will be distributed. A second phase is in development to reach more people through more facilities in more oblasts and build on learning and experience to data. Thank you. Дякую.
Thank you very much, Tatyana. The scale and the pace of which assistive products were procured and provided to those in need was incredible. And I know your work is not done yet with more kits on the ground. I now want to hand over to our last presenter, Marley Quinn, Disability Inclusion and Rehabilitation Expert in Emergencies at the WHO Regional Office for Europe. Marley is going to present to you on the disability inclusion strategy in Ukraine and the work being done in neighboring countries to support disability inclusive refugee response. Over to you, Marley, please.
Thank you, Satish. In September of last year, the WHO European Framework for Action to Achieve the Highest Attainable Standard of Health for Persons with Disabilities 2022 to 2030 and its associated resolution were adopted by all 53 member states at the 72nd Regional Committee meeting. The vision of this framework is that by 2030, persons with disabilities will be fully included and considered in all healthcare planning, delivery, and leadership across our region, including during health emergencies. In line with the framework, and of course the Interagency Standing Committee guidelines on inclusion of persons with disabilities in humanitarian action, WHO is supporting the humanitarian cluster system towards realization of the 4 must-do actions in the humanitarian response. Specifically, we're working to promote meaningful participation, generating disability disaggregated data, provision of opportunities for mutual learning exchange and empowerment, and importantly, removal of barriers to health services in Ukraine, including promoting a barrier-free approach among our health cluster partners. This year, WHO Ukraine will launch its country office inclusion strategy. This means scaling up support to national and international partners in Ukraine to combat exclusion, promote the rights of persons with disabilities, build a resilient and inclusive health system, and ultimately support a healthier population. The current strategy and monitoring framework is designed to promote rapid operationalization, and the 4 pillars of the strategy include inclusive programs, partnerships, human resources, and health cluster coordination. Now, pivoting to the work being done in neighbouring countries in the context of this crisis. Firstly, at the beginning of this year, WHO began to lead a new project in Georgia and Moldova, which aims to strengthen disability inclusion in the refugee response in both countries. This project is implemented in partnership with the European Disability Forum, UNFPA, UNICEF, UN Women, and OHCHR. This project is a collaboration and requires a joint effort to achieve our goals with all stakeholders, including ministries, local organisations of persons with disabilities, and refugees with disabilities themselves. And finally, in Poland, WHO has partnered with organisations of persons with disabilities to better identify girls and boys, women and men with disabilities seeking refuge in Poland from the crisis in Ukraine. The project aims to detail the specific needs, priorities, and their lived experiences. This will support local and international actors to drive a more inclusive refugee response in Poland. For the work being implemented in Ukraine, Poland, Georgia, and Moldova, we share collective goals. And these include to build local capacity to support a disability inclusive response and to address gaps in services in line with the United Nations Convention on the Rights of Persons with Disabilities. Thank you. Over to you, Satish.
Thank you very much, Marle, for demonstrating our support for refugees in surrounding countries and for also emphasizing how disability inclusion must be a cross-cutting consideration in the whole of response and for future planning. The ongoing nature of war means that WHO strategy combines targeted emergency surge support with this health system strengthening approach. Reorganization of the health system in Ukraine, including rehabilitation in the healthcare, began before the war. And to ensure progress in this regard, despite the current challenges, the humanitarian response must be accompanied by ongoing changes to policy and legislation within the government ministries. It is for this reason that WHO prioritizes steep progress in rapid emergency response to ensure no person is left behind in the current crisis, while also working to ensure that Ukraine is supported to build back better, a more resilient health system. This means that the learning and technical interventions from international and local emergency response will not be lost following the crisis, but rather carried forward, replicated where needed, and strengthened. Going forward, WHO, as the lead international health agency in Ukraine, will prioritize the needs, concerns, and perspective of the local population. Therefore, we aim to work in collaboration with individuals, families, and their representative organizations to ensure an inclusive, dynamic, and timely health response. We are also learning alongside Ukrainians with each intervention and each program to strengthen our response as the needs evolve. We are nearly at the end of our event. I want to take this moment to express our sincere gratitude to our donors who are listed on the slide and to many of our partners who support our work in the country and in surrounding countries. It's impossible to name all the partners today, but they know who they are, and we appreciate their contribution in Ukraine. I want you all to leave today's event reassured that WHO is committed to continue our work to strengthen rehabilitation, assistive technology, and disability inclusion for the Ukrainian population inside Ukraine and in the region. I will leave you now with another fantastic video showing the impact of rehabilitation interventions for internally displaced Ukrainians. Thank you once again for spending your valuable time with us. Please do not hesitate to reach out to us with any questions, comments, or for any follow-up. Here is the short video. Can we have the audio visuals, please? And goodbye. Thank you.
Я вимкнулася, втратила свідомість, а чоловік мій схватив мене за руку і кричить: «Повзи, тому що у нас витікає пальне, є вирогідність, що взірветься авто». І я кажу: я не можу не повернутися, нічого зробити. І він схватив мене за праву руку, відтягнув, він викликав швидку, він викликав пожежників. Коли нас розділили, він перші 3 ночі постійно мене кликав. І вони після всіх операцій нас з'єднали, тому що вони зрозуміли, що чоловік просто не відстане. І він в сні кричав моє ім'я, він боявся, що щось сталося знову. перші дні після того, як ми прийшли до тями, я сказала, що ми вийдемо звідси і ми вийдемо на своїх ногах.
Thank you.